Hi, this is Eric Dein from RHEUM Now and from Summit, New Jersey, coming at you after day 3 of ACR 2021 Convergence. It's been a great session thus far and lots of great content today. I think one of the highlights was certainly a presentation called Gift of Gab. And we have with us the 2 stars from that, the moderator, Dr. Jason Liebowitz, and the star of it, the speaker, Janet Zeide, who's from Wharton, who gave an excellent talk about communication. So thank you so much. What a great session you guys led today.
Thanks for having us.
Thank you.
Absolutely. So I wanted to start with Jason. Tell me a little bit about how the session came to be. What made you want to do this?
Yeah, so we were very lucky to snag Professor Zeide. As clinicians, as researchers, as medical educators, I think we all have many opportunities to participate in public speaking, communication, whether that's one-on-one through feedback or small group teaching. It's something that's expected of most clinicians and doctors and researchers, but most of us don't have any formal training in how to be an effective public speaker or how to give effective feedback and communication. So the idea for this session was to bring an expert on the topic like Professor Zeide, who teaches in the Wharton School of Business at the University of Pennsylvania in the communications program, to talk about what are some of the practical tips that can be used to develop your skills as an effective public speaker. So the session really revolved around quite ingenious acronym RHEUM that Professor Zeide can talk about, which the audience will be able to use to remember some key tips that she imparted. And then it was a very lively Q&A session with questions from the audience that they had about effective communication.
Yeah, I knew RHEUM was definitely an acronym that was definitely made for this occasion, because I don't think it's one that they usually teach in Wharton. Can you tell us what that stands for?
Absolutely. So R is remember your purpose, meaning are you speaking to inform your audience, or are you trying to persuade your audience? Also, know specifically what you want to accomplish with your presentation. Number 2 is H, have knowledge about your audience. It's so important to target your audience and relate to them. So you can know things about them in advance, maybe their generation, because now we say generation rather than age group, their education, their interests, their gender if possible. Whatever you can find out about your audience in advance will really help you, because you want to decenter yourself and think about your audience and what they need to hear and want to hear. Number 3 is E, engage your audience. So besides what I just said about knowing your audience and saying things and speaking in a way that will help them relate to you, you also need to start strong and end strong, because everyone has a lot of things going on these days, and they're being pulled for their attention. So I can't guarantee they will only focus on you, but if you start strong and engage your audience with something interesting rather than today I'm going to tell you about, which is very boring and never say again. And also end strong, leave them with something memorable. So as they either physically leave the room or shut off their Zoom, they have something that they can take away and remember about your presentation. U is unlimited practice. There's no easy way around it. The more you practice, the better you'll be able to say the words, the better you'll be able to recall what you want to say, as well as have more confidence. And finally, M, make it memorable. As I said, end strong with something that hopefully will even round off and come back to what you started with.
I thought that was great. And I really liked that the talk, was both about how to give large presentations as well as the one-on-one patient interaction. When you talk about having knowledge of your audience, how do you tailor it to, is it the same talk that you give in a big group versus in a one-on-one interaction?
Well, so that goes along with knowing your audience. What level of formality? If your audience is also a lay audience, or are they educated in your field of medicine? So you want to make sure that even if it's the same topic, you have to tailor it specifically to that audience. As I said in my presentation, and I'll repeat, you don't want to talk about medical terms to a lay audience. Please don't tell us how to do the operation. I don't want to hear about it. I'm squeamish. But if you tell me something that I can relate to, add to information that I already know, that will help me. But you don't want to talk down to a professional audience, because they won't listen to you and you'll have a little less credibility. So you really do have to, even if it's the same topic, the same presentation, you do have to make sure it's appropriate wording wise, delivery wise, content wise to your audience.
I think when it comes to making it memorable, I think that the one thing that I'm going to remember from your talk is what to do when you're giving public speaking, and that you're not supposed to picture the audience naked, but you had very interesting advice that I learned. Can you tell us a little bit about that?
Yes. So really, it's a worldwide phenomenon. People would rather die than give a 3-minute speech or risk extreme physical danger. And I do have a perfect record. No one's ever died in any of my classes. They cry, they carry on. They don't want to give a speech, even if it's to people they know, their peers, even if it's topics that they are very comfortable with. So how to get around that, what we call stage fright? The best thing to do is to take a deep breath and understand that your audience usually is going to be kind to you, and be happy that, first of all, you're the one who's up there speaking and not them. And also, you have to get rid of that little bit of adrenaline that you have. Use it for energy and enthusiasm, but also burn up some of it. So besides taking a nice deep breath, if you can, make a large gesture, maybe to your slides, if that's appropriate. But when all else fails, wiggle your toes in your shoes, burn up some of that adrenaline. You start that way, you'll forget that you're nervous, and you'll forget that you're wiggling your toes, and everything will go smoothly. And I have had a lot of students over the years tell me that, in fact, that works.
I like that. I like you gave the analogy of the duck moving its feet under the water and looking calm on the surface. I think I'm going to keep that one and remember that for a long time. That was really helpful.
Oh, I'm so glad.
I think that it was definitely a great session. All in all, there's a lot of information in there. I thought there were, you touched on what to do with persuasion, and in the big theme of this, conference is about vaccine hesitancy, and there's always concerns in rheumatology about compliance and behavior changes, and I think there's a lot of great information in there. So I definitely recommend that everyone check out the talk in full, and there's just a lot of pearls in there.
Hey, thank you so much. Awesome.
It was really wonderful to have Professor Zeide and Dr. Jason Liebowitz. Thank you so much for the time today and for the session earlier. And for lots more information, I encourage everyone to go on RHEUM now for all of our information.
Thank you so much for having us.